Welcome to the JEMS Report, brought to you by Clearing Events, Fire and Rescue Group, and the Journal of Emergency Medical Services. My name is Ted Lee, and I'm the editor-in-chief of JEMS Magazine. Along with Jeff Frankel, our managing editor, we are bringing you subject matter experts and industry leaders in all things pre-hospital medicine. In today's episode, we're specifically talking about EMS Week 2025 and the EMS for Children's program. So we have a great panel today. So if you guys would go around the horn and introduce yourselves, where you're coming from, and maybe give us a little bit of background of your careers as well. Thank you.
Thank you so much for having me. I'm Dr. Lindsay Jaeger. I am a pediatric ER physician and EMS physician currently in Atlanta. I was previously in Chicago and moved here in September 2023. And I am currently the Transport Medical Director here and the EMS Medical Director at Children's Healthcare of Atlanta.
And I'm Kathleen Adelgais. I am a pediatric emergency medicine and EMS physician in Colorado. I work clinically at Children's Hospital Colorado and am the EMS medical director for a couple of agencies here. But nationally, I have worked with multiple subject matter experts around the country and lead the Pre-Hospital Pediatric Readiness Project, which has conducted its first national assessment of overall readiness among EMS agencies. And I'm excited to be here during EMS Week and on EMSC Day to share about the PPRP, which is what we call it for short.
Hi, and I'm Dietrich. I'm a pediatric emergency medicine physician. I was in Columbus, Ohio for a lot of years, and very proud to be a part of the EMS system. I'm currently in Greenville, South Carolina, and also working with the EMS agencies here. I'm part of the Peds Emergency Medicine ACEP's National Committee, and also very proud to represent NAEMT, outstanding group, and part of the PPRP, which we have such excellent leadership for. So thanks for having us.
Well, thank you, everybody, again, for taking time out of your day. I really appreciate it. So what is the EMS Week and EMS for Children's? Why are these things, so important to the rank and file? Because, we see this stuff come out every now and then, and maybe some of the leadership knows, maybe some of the state agencies know. But why does just the EMS community in general, why is this important to them?
So EMS Week in general, I think, is really important to recognize these amazing professionals who, take on a very difficult job and do such an amazing job caring for our patients in the pre-hospital setting. And as an emergency physician, I would argue that the most important time that a patient gets cared for is actually in the pre-hospital setting, because if they don't get to us alive, we're not going to be able to care for them in the emergency department. And then EMS for Children's Day during EMS Week is really important because there's less than 10% of EMS calls are pediatric calls, and less than 10% of those are sick, critically ill, and injured children. And so it just really heightens awareness of the importance of being able to be prepared to care for our pediatric patients in the pre-hospital setting.
And I'd like to echo that. Thank you for that, Lindsay. It's such a nice overview of the importance. The EMS for Children program was initially passed, and funding for that was initially passed federally in 1984. And over the last 40 years, the program has gone through a lot of work to really start to elevate the level of care for acutely ill and injured children. And we're really at an important peak right now. We have data that hospital readiness actually improves patient outcomes in the end. And we're really at the very start of exploring pre-hospital readiness. And the EMS for Children program is really the only program that is directly focused on the emergency care of children, both in the out-of-hospital environment and in the emergency department. Anywhere. There are 57 state partnership programs that are all directly focused on this every day and putting into place resources and guidance for everyday clinicians so that they feel better prepared for caring for children when they go out on a call.
And I can't say enough to thank the EMS providers and the care that they give to our children. And to be honest, when they show up, everybody's busy, everybody's trying to take care of things, and sometimes we just forget to thank them. We don't mean not to, but we do. And so it's our time to honor them for all that they do. And also, a lot of them don't get a lot of resources. So we appreciate the efforts they make individually to get the good pediatric education, to get PEC coordinators, to take the extra initiative to make their agencies as good as they can for children. It's essential for us as the leadership starts to move forward to identifying how we can improve care for children. They're going to be key.
Yeah. So you mentioned a little bit that there's statistical evidence that readiness in hospitals, does impact outcomes, and that there's a move to see how pre-hospital would affect those outcomes. So what's being worked on right now to try to gather that information or to do preparation so that EMS agencies have more resources for kids, even though you mentioned about 10% of the typical volume is pediatrics, it's still pretty significant. So what are we working towards? Well,
I'll take that and then I'll toss it to Lindsay to speak to the direct resources that are available. The Pre-Hospital Pediatric Readiness Project is a project that has kind of gathered subject matter experts, liaisons, and stakeholders and leaders from about 20 different organizations, all involved in pre-hospital care, both through industry and education, and oversight. And a joint policy statement that was published by the Committee on Pediatric Emergency Medicine through the AAP, along with NAEMT, represented by Ann here, and ACEP, represented by Lindsay, and the Emergency Nurses Association and the National Association of EMS physicians, all came together to say these are the tenets of what pre-hospital readiness for children looks like. And that initial document that came out really spurred the PPRP to kind of start to identify, like, how do we do an assessment of overall readiness? And so work was initially done to create an assessment, a survey, and a lot of effort went into actually even creating a score. That survey was launched last May, almost to the year, and was completed in July. And data is forthcoming to states as well as nationally on what the state of readiness is. Data from this assessment can be used directly by EMS agencies right now through their own available gap report, where they can see what are they saying yes to and what are they not saying yes to, where are their gaps in pediatric readiness, and what can they do to kind of address those gaps. And then nationally, the hope is that this data can really drive some national initiatives to better support our EMS clinicians every day by making better quality improvement metrics for them, better education tools for them. But I'll hand it to Lindsay to kind of talk a little bit about the currently available readiness materials.
So the PPRP toolkit is a group of resources and content that can be used to address the gaps that are identified by the national PPRP checklist and assessment. And so the toolkit is organized into 7 domains that match up with the checklist, and it aligns with the joint policy statement and technical report that Kathleen mentioned. And the resources were curated by a pretty comprehensive team of subject matter experts from 17 different organizations and various different disciplines. So from physicians to nurses to pediatric emergency care coordinators to members of the Family Action Network. And we currently have almost 200 free open access resources that we go through every quarter to make sure we have the most up-to-date information and evidence. And we develop new resources to put on there for anyone to utilize.
It's an incredible amount of material that they have brought together. There's incredible resources and open access. So any agency, a volunteer agency, a rural agency, anybody can access these resources. They're top notch. They're from leaders in the industry. They're very well designed. They're based for pre-hospital, and they are evidence-based. They're not anybody's opinion. They're really based on evidence. So people can access these easily. They're easy to use. They've made them as friendly as they possibly can. And then there's some videos. If you need some learning materials for your EMS agency, I would have them open it up and download it, because it was just an incredible resource to not have to go find a speaker, especially for some of the smaller agencies that just don't have those resources.
Yeah. So where can they get these resources that are there? What's the website? Where's the location?
That's a great question. So if you just Google PPRP toolkit, it's the first thing that comes up, and it lives in the EIIC website.
EIC being EMS for Children Innovation and Improvement Center. So that's kind of where the home of all of this readiness work lives.
So with it being so much and so much information, did anybody feel like it was daunting, or that it was too much for services to look at, or maybe services would feel like, well, wait a minute, if we do this, it's going to look bad on us?
Well, I'll start by saying that the toolkit has been divided into different domains. And so you don't have to go to it and just look straight at 170 resources and not even know where to begin. If you are specifically looking for a quality improvement, kinds of resources, there is a domain that you can click on that takes you to all the QI and PI information. We do have some of the most highly rated resources kind of pinned so they're more readily and easily accessible. If you're looking for educational resources, you can go to the website and click on education and competencies, and it brings you to the list of resources. And then there's kind of accordion files that will drop down and will give you detail of, this is an online module, this is a website, this is an infographic, so that you know exactly what it is you're looking at and exactly what it is you possibly need. We also have an open place for somebody to indicate hey, I'm looking for X, Y, and Z, to see if and then that we get those emails to kind of figure out if there's additional resources. And Lindsay's done a beautiful job at looking at kind of feedback from our end users. Lindsay, I don't know if you want to share some of that information.
So we did a survey at the end of last year, at the end of 2024, asking, various different EMS agencies and the PECs, the Pediatric Emergency Care Coordinators, about different resources that we have on our website. And we essentially asked individuals to look at each of our domains and to provide feedback on the resources that were listed. And they provided feedback letting us know what was helpful, what was not helpful, what we could use more of. And so we've used that to continue to modify each of our domains so that we have the resources that, the end user is looking for.
And the team is incredible. Lindsay 100% spoke the truth. They actually review this material on a quarterly basis and go back and make sure things stay up to date. The other thing I really, really like about the way that it's set up is there's policies and procedures. So if your agency needs a sample, you can look there and find out if there's a sample that would match what you need in your community, or at least gives you some place to start. It matches up perfectly with the checklist that they have. So if you do decide that your agency wants to go forward, you can start in some of these different domains and start to build some things, and then maybe go for the full thing once you feel like you've got all your different pieces in place. So
other than reaching out directly to each one of you, if I were to have a question about this, Are there liaisons? Are there others in the group that kind of help with the best practice? Hey, we have a question. Yeah, we were able to download the PPRP and we're able to look at the checklist, but we had more questions. Where would they go for that?
There is an email, PPRP at Improvement Center. I think it's PPRP at emscimprovement.center. And it's a single email that anybody can email. It's on the website, so you can click on that under the contact us. And we receive those emails directly through the EIC to get when people are looking for things, either they're looking for a resource or they have a general question about pre-hospital pediatric readiness, that goes to our pre-hospital domain experts and leads, and then we are able to kind of get those questions answered. If it's not a question that that person has direct information about, because the PPRP steering committee is made up of 20 different organizations, say it's a question really specific to needing better educational resources, we have a NEMSMA liaison. So we have a way to kind of really have the steering committee provide some good natural oversight for any information that's coming in to us about how to improve an agency's pediatric readiness, either from an EMS clinician directly, or an EMS educator, or an EMS leader, agency leader. We are very responsive to all of those questions.
Are there representatives for each state or each region for EMS for children?
Well, thank you for asking that. In fact, all 57 states and territories nationally have an EMS for Children state partnership program. And the EIC does have a grants database. And if you Google EIC grants database, it'll take you straight to that. And you can identify the EMS for Children program contact from that database. You just have to hover over your state. And many of the programs are located in either a Department of Health at the state level, Department of EMS. Some of them are in the Department of Public Safety. Nationally, about 11 programs are housed in the School of Medicine or at a children's hospital. But there is a program manager that is working on everyday pediatric readiness for all the hospitals and all the EMS agencies in their state. And they're an excellent point of contact for any emergency care clinician when they're looking for resources.
So with this being a prominent day for EMS week, and this is just kind of off the cuff type question, what can a service do on this day today for EMS week to impact children? You've got a checklist. I'm not getting through the checklist in one day. That's not going to happen. But what could we do?
I'll let one of the others speak to that real quick, and then I can chime in.
So, I would say, the first step is being PEDS ready. And so looking if you haven't completed the assessment, going through the checklist, making sure you have all the stuff that you need. You can't accomplish that in one day, but I think taking baby steps towards being prepared to care for our most vulnerable patients is important.
I think just even recognizing how important children are, and how, even though it's a small percentage, I would argue 10% is still a big percentage, and just saying, I'm going to take the first step today. What can I do to make it better for the kids? And picking one thing. I'm going to go through the equipment. I'm going to go through the medication. Pick something practical that you can accomplish, and then recognize how much support is out there. Like, if you reach out and you want to make a difference for the kids in your community, there are people here who will help you. The kids are very important to all of us, and I know they're important to EMS, and I think sometimes they don't feel as supported as we would like them to, but there are supports for them.
And I think also, in anticipation of EMSC Day, I would encourage EMS agencies to reach out to their EMS for Children state partnership program. The program is doing, every program across the country has some activities set up for EMSC Day. There are EMSC Day resources available also on the EIC website. I would say perhaps that might be a day they could do a tabletop exercise, anticipating a child coming in. They could set up something at a school and do a safety fair day with the school. They could go through their pediatric equipment, stuff that might be dusty or old or expired that they haven't looked at in a while, and reorganize their pediatric bags and and kind of refresh themselves for some of those things. That's one way that the agency could potentially celebrate EMSC Day in its own way. There's a lot of different things to consider doing. And I think, we also have a webinar that will be, in addition to this podcast, will be available on pediatric seizure management. That is being done at, I believe, 5 p.m. Eastern, 2 p.m. Pacific. People can attend live and get an hour of CE to learn about pediatric seizure management and all of the things EMS for Children as a program have done to improve the care of kids with epilepsy or seizures. And then also there is CE available through Prodigy EMS for anyone who attends that webinar live.
So it was touched on, and I always start to shrink things down from, we have a national association, we have individual state representatives, and then local. So just who locally would you potentially be able to reach out to who may be loosely affiliated with EMS for C, or not at all, but it would still benefit to have that kind of relationship going forward?
Well, I think, first is really understanding what the structure of EMSC is in your state. Again, if it is in a state office, and their website might have information about local EMS for Children contacts. I know, like, for example, the state of Utah, every county in Utah has 2 EMSC coordinators in their county. So an EMS agency could look to that. In Colorado, where I work, we have 11 regional emergency and trauma advisory councils. All of our councils in Colorado are heavily involved with our EMS for Children program here with regular meetings, and many of them are doing their own EMSC Day activities. They also often are our kind of partner and liaison for getting EMS education out at the EMS agency level on the care of children. So there can be their EMS for Children state partnership programs all typically have that contact information, sometimes a website at their state, and they can often look at those that information to kind of identify who in their state at their more ground level could they potentially contact and be more directly integrated with.
They can talk to their EMS medical directors.
Yeah.
They can go through their medical director and ask, say, can we do some emphasis on children? And the EMS medical directors have access to lots of resources, as she has just gone through for you.
Well, we're just about up with time. I wanted to thank you all again for taking time out of your day to talk about EMS for Children. And I'll send it around the horn one more time. Any closing comments for EMS Week 2025 and the importance of EMS for Children?
The only other thing I want to add is just, I can't say it enough how much I truly appreciate our pre-hospital clinicians and everything that you guys do. I know that, really sick, critically ill, and injured children is a very stressful event, and we are here to help you feel more prepared. So as, Kathleen and Ann said, reach out to your local medical directors or your state partnership program for resources, because we are here to help you feel more comfortable preparing for our sickest, most vulnerable children.
And I feel the same way. I mean, I feel like we see our EMS clinicians from around the state through the work that I do in Colorado, and often they remember that child that they took care of like 8 years ago, 10 years ago, 20 years ago. It never leaves them. And I think, feeling unprepared to take care of a sick child is the worst feeling for anyone, especially if you're a rural EMS provider and you actually know that child because you live in a close-knit community. We're so grateful for everyone being out on the front lines every day, available every time that phone rings into a PSAP and they get dispatched, and the work they do every day to be best prepared to care for their community. I just can't thank them enough.
I have to 100% agree with both of them. We just can't thank them enough. It takes a lot to go into people's homes, takes a lot to face it head on, and as they've both said, it's critical. That first 30 minutes, half an hour, 45 minutes makes a world of difference for each child, especially the more ill they are, or if they're having a seizure, it needs to be managed. So I want to thank them for doing that. And I want to encourage them to take their fear and their feeling of, I can't master all of this, and put it into, I'm going to do a better job next time. All of us every day in emergency medicine just say, okay, how can I do it better tomorrow? What can I learn? Where can I get some more information? And then use it to give better care. And they are incredible. So I know they're going to take on the challenge and they're going to do what needs to be done.
Well, thank you all again. We look forward to hearing more from you and from EMS for Children. Please feel free to reach out to JEMS if you have more information, press releases, or articles that you'd like to get out to the broader EMS community. And we just wanted to thank you again.
Well, I just want to thank you for highlighting EMSC on EMSC Day and giving us a bit of a platform to get the word out about the importance of the program and how the program is available to everyday clinicians. Really can't thank you enough for taking the time to meet with us today.